you know, we are choosing the right size with the patient, and according to her breast size, her chest size, basically gives us the floor diameter of the prosthesis. That's the area we have to fit with that. After we find out this, we set up and we find out, let's say, with the patient how projected she wants. There is a degrees of it: high projection and high plus, moderate, or it's just like a surface thinner. That nobody wants that basically, but mostly we are doing high profile. It's giving that decollete area that curves into there. So yes, we are mostly choosing high profile or high plus. So also the degree is the diameter of the chest, of the breast. One breast diameter would give us the volume. Mostly patients, not for transgender patients, but for non-transgender females, they're all the time coming with the volume. They want, they say, I want 500 cc's, I want 400 cc's. Actually, we have to decide how their body suits, first of all. So with that, we calculate the volume. But basically, I have tricks of it. I ask you to which size of bra you want to use in your social life. I will ask you. Prepare yourself. Okay. When you are here, I'll ask you. So, just kidding. If somebody asks for top surgery, yes, I ask them to at the bra which one you want. So if you fulfill that bra with the prosthesis, you will find the volume you have to put in. It's just a being of how patient desires, because she saddles up the breast size. So we realize that how she wants, and then we calculate that diameter, and we choose which projection she wants, because with the diameter and there's a volume of the prosthesis, because the sizes that we have the measurement of this, the desired breast. So with that, we find out with that volume and diameter, we find out the projection type on the catalog. Or anyway, we already know this, so we just directly say you want high profile. So, and then this is being preparation of it in a surgery. And during surgery, the difference between gender affirmation top surgery is there is no inframammarian fold, as we called. There's a lower limit that suits and carries the prosthesis. So we cover the prosthesis with breast muscle, and from under of it, basically we have few tricks like a supporting tissue from somewhere else, the other muscles, fascia, or synthetic things to cover this. Every of it has pros and cons, and it differs from patient to patient. For example, if you are smoking, basically I will not suggest you top surgery because if somebody smokes, there is an increased risk of infection, surgical risks in every mean of it, because of the reduced tissue oxygenation. But anyway, if we have to do top surgery for patient smoking or for elder age, we do prefer natural tissues or muscle fascias to cover the prosthesis. But otherwise, we could be able to use synthetic products without any necessity. So we need to reconstruct that lower fold to carry up the prosthesis. It means it's more than simple augmentation. It needs its own tricks. So that's why the top surgery has different name, not like a simple breast augmentation. And after that surgery, some of us giving supportive breasts, some of us using band-aids For gender affirmation top surgery, I do use bras to support that prosthesis carrying the tissue in the fold, in the lower fold, so that you have that comfort, especially, and also you will feel like get shaped with that support. And it takes 2 or 3 months. Use that bra. It's supportive bra for sportswomen, as you could know, the tennis players. It's supportive like that. But you know, basically, we are asking from our patients to stay here for all kind of feminization surgeries at least 2 weeks. So we are caring well enough and we are being sure enough about that they will have no problems when they go back. Even with that, because of the risk of surgery, we need to care. We need to have aftercare of our patients. We need to check them all the time how it goes. So yes, it takes 2 to 3 months to seeing the real results, because slinks over there, so it finds its place and it looks more natural. But in the beginning, it looks like it's a lot lifted. So it gets in the lower area and it finds its way with its own capsula. After that, capsula has been established as being produced in your body, so it protects your prosthesis on your chest wall inside, so it keeps it under of it. And there's a basic risk of silicone implants, basically, and there's saline implants, which I will talk in the next. That silicone implants has their own risk about infection, about reject from the body with hypersensitive reactions and capsular contracture. There's all risk of this. So basically, that I use top brand to me. I don't want to give the brand's name because it would be advertised. We use that, and we give the information and tags of the and the codes, barcodes of the product to our patient, so she knows wherever she goes which one is inside. So these are really important things because it's brain material anyway. Yeah, these are I think right now there's sixth generation of it, so it's being like is more than 50 years about breast prosthesis. So these are really high quality industrial products, and they are producing without any hand touch. They are producing into closed facilities without any touch of human. So they are becoming as sterile, and they are using one time only. So if you want to change this, it's just a trash. We open new one and replace it. So with that product, they are more safe. You know, we can give the surgical success as 98%. So yes, there is a foreign material, but this is the most success surgery of plastic surgery as a cosmetic types of it. So yes, even there is foreign material, this is the best one as a lower surgical risks. So, but even with that, there's the risks of that foreign material. To reduce and to keep up and to care of that, we are giving some information to our patients. One of this is don't use tobacco products, not before surgery only, during surgery, after surgery, all the time, till you get healed, till we are being sure that you are well enough. So coffee is another factor. If you're drinking a lot of coffee, you reduce your wound healing rate, so it affects this. Yeah, basically aftercare is 2 or 3 months to get the result, to be sure that you are well enough. But in that implants, there is a type of these risks, so we have to care enough. We have to see each other periodically to be sure everything is going on, everything is going right. And all the time after you go back to your country, we all the time say that if possible, and if there is an organization like this, please go and check locally that they are being sure that you are well enough. So you can find any contact in your country to go after care and have their opinion face to face. It could be general practice. We are just asking for any kind of doctors, medical doctors, to evaluate, to assess the soft tissue if it's okay. Yeah, that's our specialty. That's my specialty. But you know, about soft tissue chains, some professionals are checking this. We are trying to do in everywhere to reduce the risks with that. And also, yeah, say this is the next saline implants, which is so popular in the United States. They are having same risks because they are covered with that silicone also.
Thank you, Dr. Emma, for that's quite a detailed answer, scientific answer, and it's nice to know the technical details and even how you manage risks and how you even make sure that the aftercare, even the comfort levels are improved. And it is definitely a work of art. I can clearly see that it's more than it should take several years to go beyond just an implant being placed in the breast tissue rather than it's quite a lot of work and a careful study, scientific study to understand the impact of food and stuff like that and the aftercare procedures. So really nice to know all those things. I think we are coming around 30 minutes pretty much, and we didn't know the time flew away. Last time when we did our discussion, of course, we didn't expect it, but there have been quite a lot of calls from girls, and they've been asking a lot of questions. I said, don't feel shy, feel free to reach out. So I think we should leave with that message both in Turkey and the UK or around the world, back in India or in the US and Australia too. Been getting calls, so feel free to reach out to either Dr. Emma First coordinators or reach out to me as well. Feel free to ask scientific questions. If you got any questions or topics we discussed, any topics you would like to hear about, of course, we are after scientific approach. There will be some fun facts and something to smile about as well. So we'll try to bring everything to the table, and feel free to reach us out or any or YouTube. Our patient coordinators are always there to help. It could be just a scientific question. It should be a general query. Feel free to reach out, and we're always open to answers. And it is a much larger forum. We are trying to build something larger than life, and that's kind of we're taking the first steps into it. One of them is about the FFS Center in Antalya. That's something which is close to all our hearts. Beyond that, it could be a forum for all the healthcare professionals, surgeons, and the transgender community to come together and discuss things scientifically and take things forward. That's from my side, Dr. Mafu. If you would like to add a few words, probably we can close with that.
I really have proud of being part of this all the time. I say, when I hear the stories of the people about gender affirmation and about how they prepared, how they have lived in the past, and there's a great journeys, there's a great wars in their lives. So I really have appreciated, and I really proud of being part of this. I all the times say that till being sure about your gender identification and about gender affirmation, till being sure, you can go for it and you can ask for this. This is reality of being human. So you can help the people has lived this before, and the people has supporting surgery of it, the social life of it. It looks like in the end we will be the winner because that support getting its power in time, day by day. We are seeing this, so we are doing this proudly. And I'd like to say we'll set up a YouTube streaming channel soon. So we will have, as you told, podcasts from US, Australia, New Zealand, UK, Germany, Canada, every part, every corner of the world, South Africa. So there's that connection, internet, making us more powerful. because it binds us together without any restrictions of the distance. So we touch each other and we talk about this. So we are being part of this and we are try to support this enough. So yes, we are establishing a YouTube video channel soon in the next month. And also the new clinic in Antalya is being FFS Center, or in a bigger mean, it's Feminization Center would be. So basically in the next month especially, the only part of my surgical practice is being FFS mostly and feminization surgeries. So yeah, mostly I can say probably I'm not doing any other surgeries at all. Maybe only reconstructive and revision surgeries. But otherwise, the primary surgeries mostly are being FFS and other feminization surgeries. And also, I'm accepting secondaries, revisional surgeries of FFS, probably. So trying to fix whatever somebody done on people's face or body, I'm trying to fix them all exactly. So yes, we like this. We are having proud of being part of this, and I'm accepting any questions about gender affirmation directly in Instagram. When you write down any questions on Instagram directly, I'm trying to find a time to answer them all about feminization surgeries, especially because we are doing this, we are doing great, and we are having proud to part of this. So let's say go on and get more powerful in time.
Uh, that's a lovely message, and that's a nice message to take home. And we can call it a day for that message, Dr. Emoko. Wish you well, and it's really brilliant talking to you today. And it's nice to bring all this information out and kind of share it with the community as well. I'm proud to be part of this journey as well. So really nice to know, and hope to hear from all our girls as well. So have a lovely day, Lady Jack.
Thank you so much.
Thank you.
Thank you so much. Thank you for your time. Take care. Let's say in the end, ciao.
Yeah.
So see you next time and keep all of us. Take care. Bye bye.
Ciao. Until next time. Bye.